All right. It is 3 minutes past 11 a.m. by my computer here. I think we can make a start. We have about 26 colleagues online already. So thank you for joining the Regional Capacity Building Workshop on Undertaking Inequality Assessments in Civil Registration. I am Sharita Sarao from the ESCAP Statistics Division based in Bangkok. And let me now give the floor to Ms. Rachel Bevan, the Director of the Statistics Division at ESCAP, for the opening remarks. So over to you, Rachel.
Thanks so much, Sharita. And let me also say good morning, good afternoon, good evening. I'm not quite sure where everyone is, so I'll cover all of those. So as Sharita said, I'm Rachel Bevan. I'm the Director of Statistics Division here at ESCAP based in Bangkok. And it's my real pleasure to be able to welcome you all to this third regional workshop on strengthening capacity to carry out inequality assessments of civil registration and vital statistics systems. So this workshop will focus on the practical elements about how to actually go about implementing an inequality assessment and evaluating the results and their relevance for policy making. So as you all probably know, here at ESCAP, we're implementing an initiative to support inequality assessments of CRVS systems. And this is a key step in the regional action framework of the Asia Pacific CRVS decade. But few countries have actually been able to carry out these quantitative inequality assessments. So this is an area that we know needs more action. And the work we're doing now is to help to actually fill this gap and to increase the number of countries who can do this important work by the end of the CRVS decade in 2024, which isn't that far away now. So we've just got another 2 years to really make progress on this. So the need for inequality assessments has been highlighted, particularly by the COVID-19 pandemic, where we could really see the exclusion of certain groups from civil registration systems. And that's actually meant that we will never really truly know the full impact of the pandemic. But this is actually really especially true for some of those most marginalized and vulnerable groups where we really don't have enough information. So today, I know that we've had more than 75 registrations for this workshop from across the region, similarly to the other national CRVS workshops that we've held. And we've had registrations from all kinds of different people. I was just looking through the list of participants, and it's great when you put your country name there as well, so we can actually see at a glance as well who's actually there online. So it's great to see all the kind of different countries that we've got joining today. And I know that it's a slight shame that we're not able to do these training workshops in person, and we're having to kind of do this virtually, as we've done the last couple of training workshops virtually. But, you know, even though there are some drawbacks with the virtual aspects, and it means we can't all have coffee and lunch and things like that together, but some of the advantages actually of being able to do this training virtually means that we're actually able to reach that much wider audience from across the whole region. So we really hope that that is the case today, and it's great that we have so many people who are actually able to join. But we also do want to be able to follow up this virtual training with some more face-to-face meetings, particularly as travel restrictions are now being able to easing across the region, which is fantastic for all of us. So inequality assessments of CRVS systems are hard to do, and we all know that, and there isn't much guidance out there on how to actually go about doing these, but we know that they are really important if we're actually able to meet our commitments to develop truly inclusive systems. And we're really hoping that this training this week will help to place all of you in a much stronger position to be able to implement an inequality assessment, and then more importantly to be able to actually use the results of these to affect policy change, to really make sure that we are leaving no one behind. So we're going to be using a mixture of plenary lecture sessions with real practical sessions. And please, please, please do feedback as we go through this, because it's really important that we can actually make changes to make sure that the training is as useful as possible. And we know that we're all kind of learning how to use kind of these different forum, and using online virtual training can be challenging. So please, if you feel something isn't going as well as it could be, just let us know, drop us a message, put a comment on the chat bar. So we really want to be able to respond to make sure that we are flexible and kind of make the training as useful as possible for everyone. So with that, I'd like to wish you all a very, very successful workshop, and I hope that you have some really great discussions, and please just make the most that you can of this opportunity. Particularly, try to engage as much as you can, use the chat bar, use the kind of, the sessions that you have. It's great to hear from as many people as we can to make this session truly interactive. So I'd like to wish everyone all the best with this workshop, and thanks so much, Sharita, and to all the others that have been doing the organisation and all the work that goes on to make this a success. Thanks very much. Bye for now.
Thank you, Rachel. So as Rachel has pointed out, this workshop is going to cover the practical aspects of conducting inequality assessments, and it's designed with a good mix of lectures, exercises, and plenary discussions. The workshop will be facilitated by Ms. Renee Sorchik. She's the consultant who's working with us on the Inequalities Assessment Project here at ESCAP. Renee has over 2 decades of experience in analyzing health-related data as well as strengthening CRBS systems in developing countries, and she's worked with a number of national governments across various world regions on providing technical assistance in regions such as Africa, in Asia, the Pacific, as well as the Arab states. So before I hand this over to Renee to run the workshop, I will just walk you through the agenda to highlight some of the topics that we will be covering over the next 4 days. And may I now request, for the slides to be put on. So this workshop will run from 11 a.m. to 2 p.m. on all the days, or all 4 days. On Friday, which is the last day, we might close a little bit earlier if we've been able to cover everything. But typically, we would ask you to please block your time from 11 a.m. to 2 p.m. Bangkok time from today until Friday. So today, the first day of the workshop, we will begin. I believe all of you do already have a copy of the agenda with you, which you received as part of the package that we sent out prior to the workshop. But if not, you can just follow what is on the screen right now. So today, the first day, we will begin with understanding the rationale for promoting and conducting inequality assessments and how to begin planning such assessments at the national level, including, for instance, the type of subpopulation groups that should be identified for such assessments. Why is geographical location an important consideration in order to ensure that any related policies that emerge from these assessments actually reach the right groups of people and in the right locations? So we will cover some of these aspects in the first few lectures this morning, and then we will move into some of the data-related issues and the mapping of available data. So who should we speak with when we are identifying suitable data sources? Who are the potential data providers for birth and death at the national level? And from among all the potential data sources we managed to identify, how should we actually select which data should be used to conduct the assessments? And we will also look into issues related to the data deficiency. So if there are missing variables, what should we do? How should we find opportunities, for instance, to use proxies or link with other types of data sources? So these are some of the topics that we will cover for today, and hopefully this should set the scene for what we get into tomorrow. Next slide, please. So tomorrow we will get into more details on assessing data for usability. And we will begin with the methodology for measuring inequalities in registration completeness and the complexities of actually measuring birth and death registration completeness. And at the same time, what we need to look at is how can we assess if the metadata for the key disaggregation variables actually align across different data sources. This is a typical problem that I think emerges in many countries, because some data sources, for instance, for the sex variable might just include male and female, others may include male, female, and the other category. So how would you align across these different data sources? Similarly, for age, some would use single years, some would use age, some data sources would use age groups. Ethnicity, different ethnic groups would be collected in different data sources. So we need to see if the metadata across these different sources actually align. And we will have a couple of lectures covering that tomorrow. And once we know which variables align across the sources, how can we actually assess the quality of the data and deal with the missing variables and check for consistency of data over time? So we'll get into all the nitty-gritties related to the data, the deficiencies in the data. Tomorrow, we will have a couple of exercises in there to help you to reflect on the data in your own countries. So we'll end with a few exercises today as well as tomorrow. Now, next slide, please. So on day 3, we will be shifting the focus a little bit to get into data use. And we will see how do we move from performing the disaggregated death and birth registration completeness calculations, say by a range of disaggregation characteristics such as sex, age groups, ethnicity, geography, and so on, to actually interpreting the results when we put all these variables together. So when we put all these different disaggregation variables together, how can we actually interpret the results? Because this will help us to identify which are those population groups that are being left behind. And to eventually understand if our data and results are robust enough, ideally, we should validate with other data sources and even check the consistency of the same data, but collected over time. So on day 3, especially in lecture 12, we will be looking into how to evaluate data at the national level by comparing completeness derived from other sources. Now, on the final day, which is day 4, next slide, please. That's on Friday. We will continue with the interpretation of results and how these results or these findings from the assessments can be elevated to policy recommendations. So how can we actually report findings from birth and death registration completeness to policymakers, and what would be the best way to formulate these findings to make them more understandable and to actually bring them into policy use. And in one of our last lectures, we will also try to touch upon a few institutional issues for planning inequality assessments. So we just want to ensure that these inequality assessments are not a one-off endeavor at the national level, but they are something that are conducted in a systematic way at regular time intervals so that we can continuously monitor inequalities in registration at different points in time. And this would be the only way to ensure that our systems are truly inclusive and no one is left behind. So that's how, the 4 days have been designed, and across all of these lectures, they will be mixed with all the exercises that have been prepared. So we will give you time to work through the exercises, but as Rachel mentioned, we really request you to come back and participate in the plenary discussions and provide your ideas, your experiences, and the results of what you work through in the exercises. So in the next slide, please. So as Rachel already mentioned, this workshop has so far over 75 registrants actually across 27 countries in the region. As you see, the majority of our participants are coming from national statistical offices as well as national agencies related to CRVS, a few line ministries as well, which is extremely relevant because we're bringing in the policy discussions as well. And it is really a large group to actually have this kind of workshop online. And of course, we will have challenges to run all of this online. So we really request for your active participation to the extent possible. I believe most of you are already familiar with the use of MS Teams. So when you would like to share your thoughts and ideas, you may enter your comments in the chat box in MS Teams. You may also use the hand raise option and raise your hand to take the floor. But as part of this workshop, we are also trying another tool, which is called Jamboard. And this is a kind of a digital whiteboard, which can be used for people to post their ideas simultaneously. So there are some tools within Jamboard such as using a sticky note or using a text box. And this provides the opportunity for different participants to actually enter their ideas simultaneously. So what I will do next is I will provide a quick demonstration on how to use the Jamboard so that everyone is ready to use the Jamboard when we begin the lectures and the sessions. Panita, if you could stop sharing your screen, then maybe I can share my screen from my end. All right, so I believe all of you can see the Jamboard right now. And so this is the digital whiteboard that I was talking about. This is the first page that we have, but it actually has multiple pages and you can scroll from the top to go into the multiple pages. We have prepared some questions there for the exercises which will be used across the different lectures. So right now, you don't need to get into all those pages. Let's just focus on the first page here. And on the left-hand side, so there will be a link that we will provide in the chat box, in the MS Teams chat box. A link will be provided. All you need to do is click on that link, and then you will land on this page that you see on my screen right now. On the left-hand side, you see a toolbar actually, and there are various tools there. There is a pen for you to use, and you can write or draw, but you basically don't need any of those tools. What you will mostly need is the sticky note. So if you click the fourth one, it's a sticky note. It pops up this way, and then you can type your ideas in there and just save it, and the sticky note will come onto the screen. So so that's as simple as to use the Jamboard. There are certain other options like inserting a text box if you wish, but you won't really need to do that. And in case you want to get rid of your sticky note, just right click and delete. Please do not use the clear frame option because that will delete everything on the screen. So if you just want to get rid of what you have put in, you just need to right click and click delete. So what I would do is, since this is a large group and we're unable to go around the table to do introductions, maybe this is an opportunity for us to just try our hand at Jamboard. So if all of you who are online right now could kindly click on the link which is in the MS Team chat box and land on this page, we would request you to post your name, your country, and your institution here so that we can have a quick overview of everyone who has joined us this morning. So would you like to try that now? And yes, in case you have any difficulty, then just please post a comment or question in the chat box. So colleagues, just a reminder, the link to the Jamboard is in the chat box for MS Teams. Kindly click on the link and you will land on the page.
I'm not sure that you lost the Jamboard screen.
Yes, so I can see a lot of you already putting in your name and country there. It would be great if you could also enter your institution so that we know which part of the government or other organizations you represent. So this seems to be working well. And I think, as I mentioned, across the different lectures and sessions, our facilitator, Rennie, would basically be asking you to use the Jamboard to post your ideas in. All right. So if most of you are comfortable with that now, I'll stop sharing my screen. A few other issues that I want to touch on is that all the presentations for this workshop, the exercises and relevant materials for the workshop will be provided through Google Drive. So we will also be posting in the chat box a Google Drive link, and you can go into the Google Drive link and access all the materials that you need. So while Renee is presenting, in case you cannot see her slides clearly, please go into Google Drive and download the slides on your own computer. And that would probably help you to view the slides better. We will also request you to complete an evaluation on the last day of the workshop to help us to make future improvements in such sessions. And for all participants who are able to join the workshop on all 4 days, who participate actively and complete the evaluation, we will provide a certificate of participation after the workshop has been completed. So at this point in time, that's all for me. Are there any questions for clarification at this point before I hand the floor over to Renee? Please feel free to post your question in the chat box or raise your hand. I see none so far. So let's just do a quick group photo while Rachel is still online. So we request participants who are online to kindly turn on your camera so that we can do a quick shot, and then we will move straight into the sessions. Thank you. Panita, Pim, please do tell us when you're taking the shot.
Okay.
Sure. Hope everyone is ready. Take a photo. All right, 1, 2, 3. Just hold on. I need to check the quality. Okay. Maybe one more time. 1, 2, 3. Yeah. Thank you. Thank you.
Thank you, yeah. Panita and Pim. Thanks, everyone. So if there are no questions at this point, and I mean, you have a rough understanding of what the 4 days look like. If anything comes up, please put it in the chat box. Happy to address any questions or concerns as we go along. So for now, I will now pass the floor to Renee to take over for the lecture. So over to you, Renee. Thank you, everyone.
Thank you so much, Sharita. Good morning and good afternoon to everybody. I'm Renee Sorchek. I'm an independent consultant working for ESCAP. I have 15 years of experience strengthening vital statistics, civil registration in countries all around the world. So I'm very excited to be here with you today and to start discussing inequality assessments. So I will start by sharing my screen, and I'm not sure if this will work, so you'll have to tell me what you see because I'm hooked up to another monitor as well, so it might be a little wonky. Okay, so if I go into view, can you see it like normally, or do I need to edit it?
It looks fine to me, Renee.
Okay, fantastic. So we'll go from here. So if I just one quick second, is this still okay?
Yes, it is.
Okay, fantastic. Okay, so we'll go ahead and get started. And as Sharita has already mentioned today, some of the things we'll be discussing is what exactly is an inequality assessment? Why might we do one? And how would we plan to do one? So the first lecture we'll be talking about is just these things, and basically what is it and how do we plan for it? So it's helpful to understand what an inequality assessment is. It's a quantitative assessment to better understand whose vital events are not being registered within the country or territory. So we want to make sure that no one is being left out. Even if registration completeness is at, say, 99%, we want to know who that 1% being left behind is. So it's a quantitative assessment to better understand who those people might be. And the purpose is to provide evidence to inform policy so that you can put interventions in place to make sure that everybody is included and you can aim for 100% completeness of birth and death registration. And ultimately, the goal is to provide everyone with a legal identity through birth registration, and also ensuring that vital statistics can be disaggregated in a way to improve the health and well-being of the population. We know that different populations have different mortality levels, they die from different things, but without the data to understand what is going on, we can't put in place interventions to improve the health of different populations. So I think it might also be helpful to talk about what an inequality assessment is not. So this is a big not sign here. It's not an exact science. And in that way, it's not a rigorous academic exercise to be published in a peer-reviewed journal. So often our data is going to come from administrative data sources, and especially when you start disaggregating the data down to lower levels, the data quality is just not as robust as it might be as if you do, say, a census or a household survey. Maybe just a note here about about administrative data. Administrative data, such as a civil registration system, it's collected for the purpose to provide people with documentation or for administrative purposes for the government. It's not collected for the purpose necessarily of collecting data. So while it's a great source to inform things such as births or deaths, it is not collected solely for the purpose of data use. And similar with things such as, say, school enrollment data for the Ministry of Education or vaccine registries for the Ministry of Health, these are all more about administrative purposes. They have other primary roles, but they also have really great secondary roles. So in this way, we can't maybe be quite as rigorous as we would like to be. But on the other hand, you know, an inequality assessment is not a summary developed by word of mouth or a rough guess. So we're trying our best to assess with as much rigor as possible, using the best data possible, who is being left behind. So while we are aiming to be very accurate and have good data, it's not going to be perfect. But we do want a level of certainty to understand who is being left behind, and also the magnitude of perhaps the inequalities in registration. So are they 50% less likely, 25% less likely, 20, maybe 10% less likely, or in a range? Because this will help us understand where to focus our limited resources in order to strengthen registration. So, you know, in the beginning, perhaps we only have so much money and time and resources, and we want to know where to target those to improve registration. So in summary, we might not care about the exact percent, say, you know, 25% completeness within a certain population, but we do care about how far behind they are from the overall population, because it's important to understand the magnitude of difference. So why do we care about birth and death registration completeness at all? Why are we looking at this, you know, the inequalities or disaggregated level? It's measuring completeness of birth and death registration is one way to evaluate the CRVS system and its performance. And we also need very robust vital statistical data from the system in order to, you know, if we are going to make fertility estimates or, say, life expectancy estimates, we need to understand how complete our data is, because this will affect our estimates, which could affect policy down the road. So if we want to know if the health of our population is improving, if we want to know if our population is growing and our policy is based on that, we need to understand how complete our data is. Further, on an individual perspective, without complete birth registration, we can't provide everyone with the legal identity they're entitled to. And it's especially important to know who is being left behind, because those who don't have the legal identity are often going to face more challenges in life. They might not be able to register for school. They might not be able to open a bank account. They might not be able to apply for certain jobs or occupations that are often better paying and have more opportunities. They won't be able to get a passport, etc. So there's a lot of things, a lot of opportunities that having a birth certificate can afford a person. And from a population perspective, if we don't have complete birth registration, we can't plan for the future. So we won't be able to estimate the growth of our population, the size of our population. In the short term, we won't be able to know how many vaccines we need to order for the children that are being born, how many hospitals we might need in the future, how many schools and roads and all the other infrastructure to be built in order to service that population. And in terms of death registration, if we don't know who is dying, where, at what age, and what from, then we can't put in place interventions to ensure that future deaths with similar causes to similar populations don't occur. So we need to know what interventions are needed to save lives. So it's very important that we understand who is dying, at what age, and where, and what from, because we know that different populations die from different things. We know that young children die from very different things than older adults. We know that, women die from maternal mortality and men do not. And so there's a lot of different things different populations die from, but we need to understand that better at a more disaggregated level to improve health and well-being. And I won't go into too much detail. I'm sure you're all familiar with SDG target 16.9, legal identity for all, but that's just to say that the for all means 100%. So not 90%, not 99%, it means everybody. And similarly, there's target 17.19, and one of the indicators is 100% birth registration and 80% death registration completeness. And there are 17 SDGs that will require cause-specific mortality data, and they're best generated from a very strong, robust CRVS system. And for all of these, we would really like to be able to disaggregate by different variables such as sex and age and ethnicity, geographic region, etc., because we want to know who is being left behind. And as I'm sure everybody, well, hopefully is aware, the ESCAP Regional Action Framework Goal 1 is on universal civil registration of births, deaths, and other vital events, which is part of what this workshop comes under. Didn't move slides. It looks like I'm frozen here. Let's try again. Okay. So what happens when some populations are left out? So this is just a very simple example here. So if you looked at registered deaths by age, and then you look at perhaps the estimated, maybe what you believe to be true, and then you calculated something, say life expectancy on that. And you can see over here that your completeness is not so high, and you're especially missing these young children. So it's very low death registration. But if you were to take just registered deaths and you made a life expectancy estimate, you would say, okay, in my country, a baby born today would be expected to live 73 years. But in reality, if you actually looked at all the deaths that were occurring and you did that same estimate, you would only get a life expectancy of 62, which is 10 years less than what you would get. So when you aren't capturing everyone, and especially certain groups are lower than others, your resulting estimate is not very accurate. And so it's important that we have information that we aren't leaving people out. So I think we'll just a very basic example of how would you measure registration completeness. And in this example, we just look at births. A lot of you are statisticians, and so it's probably helpful to visually just see the very simple equation. So you would look at registered births, usually from your registrar general, civil registration office, whatever the institution is in your country, divided by the estimated number of births from another data source, and the two time periods should match. And so we'll talk about what these different estimates could be and some of the caveats around them as we go on. But the idea is that your numerator up here is always going to be your registered events, And your denominator is your estimate, and you'll use the source you think is the most complete and the best of high quality and accuracy. But one thing to be a note of is when we start talking about inequality assessments, more detail is needed. So all of a sudden, we don't just have registered births. We have registered births, say, in a certain location in the country to a certain population. This happens to be children under age 1. And then we need other information too to understand between what period. So sorry, this got cut off. It's supposed to be 2020 here, and then our denominator needs to match. So now we also need the same location. In this case, it's Capitalville. We also need to, it should say children under age 1 down here as well, because we need to make sure that we're comparing apples to apples. And this is some of the things we'll discuss as we go along in the lectures. So who might be some of the key stakeholders that you would consider for an inequality assessment? Well, the core members working very closely together would be your National Statistical Office, your Civil Registry Office, your Ministry of Health. And in some countries, there are other government entities that work very closely in civil registration, improvement, and vital statistics. Sometimes Ministry of Health is highly involved. Sometimes there's IT departments that are very much involved. Sometimes it could be local government, municipalities, etc. And all of these people would then work with the data producers. So sometimes the data producers are the same thing as the core members. Obviously your civil registration office is going to provide you your registered births or death. Sometimes you'll use Ministry of Health data if they have good estimates for births or deaths. The National Statistical Office maybe has a household survey or census. And then other line ministries might be data collectors collecting other sources. Your government IT systems might be a critical partner, especially if you start linking different databases or if you need some database extraction or cleaning, then they're a key player in all of this. And in some cases, there might be some NGOs or even churches. If you were looking at, say, smaller district levels or smaller communities, churches often have a very thorough logbook of births or deaths or other events that you might be able to compare to registered events in the community. And sometimes there might even be some private entities. So one example might be cemeteries. If they're privately run, they might also have a very detailed record keeping of deaths in that area. So this is particularly relevant if you were looking at things on a pretty low geographic level. And then you have a number of data users. So the same ministries that you would see over here, they're going to be using the data to inform interventions, to improve their policies, to improve data collection. Policymakers especially will be interested in the data to help improve registration. You would also want to involve civil society and NGOs. They can help be good advocacy partners and also awareness in the community. Academics are going to be very interested in the results, especially if there's perhaps certain people that are being left behind, and they can help explore further maybe why that is and what can be done to improve civil registration. And as well as the media and journalists to help get your information out there and make sure it takes hold and people are interested in trying and just galvanize momentum. And then there might be some supporting stakeholders such as UN agencies or maybe other international organizations or NGOs in your country that can help you throughout the process as you go. So it might be helpful to just look at a very high-level roadmap of an inequality assessment. So the first step would just be for maybe the core group members consider the national context. So who might be the subpopulations of interest, who might be left behind in your country, kind of what do you already know? And then from there, you would think about available data sources. So maybe there's already been a census or a survey, such as the DHS or MIX, maybe has looked at birth registration, completeness, and it could be disaggregated by different characteristics. And then also doing some interviews with different line ministry and data collectors and trying to understand what's being collected, what's public, what's not, what could be shared, etc. And then once you understand the data that's available, determine the feasibility of it, you would review the data quality, have a look about if your metadata aligns between your numerator and denominator, et cetera. And then from there, once you know what data you can use, you can perform your analysis and then try to understand what your results mean. And then it's very important to write up your findings, especially for policymakers with recommendations. Even though you might not feel like the expert, you are the expert. You are the one doing the analysis. You are the one understanding the data. So it's very important that you share the data with those that can help put in better policies to improve registration. And then once those interventions and improved policies are put in place, then hopefully also you can work on strengthening data collection, and then you can monitor your improvements. Is completeness going up, or is data collection improving, et cetera? And maybe in 5 to 7 years, you would then consider doing another inequality assessment to just see how things have changed over time. This is a little bit more detailed example from that roadmap. So for example, maybe you would start off with an inception workshop where you involve all stakeholders and you have some discussion about who maybe the subpopulations in your country would be and what you can look at, and start to form relationships, especially with the ministries or other partners or entities that have data and are collecting data, and try to get the momentum started and everybody on board. And then from there, the core group would do a desk review and try to find what data is publicly available, at what level it's disaggregated, assess some, inequality concerns, and then do some interviews with line ministries and other data producers to try and understand what other data might be out there and what could be shared. And then once they understand what data is possible or maybe could be shared, they would assess that data for inequality concerns or completeness, and if it covers the subpopulations of interest. And then from there, they would perform the analysis. And this would probably be the core group of members that we saw in the previous slide. And they would write up the findings and as well as policy briefs. And while the core group might be the ones writing up the findings, they would definitely consult some other experts and target lots of different data users. And in that way, it might be helpful to have a dissemination workshop where all stakeholders are invited again, especially all the different data users we discussed, and to share the results so that the people can really take hold of your findings and start to put in place interventions and take actions to improve registration of vital events. And so then once the interventions come in and there's lots of activities to improve registration, then hopefully there could be some kind of monitoring process, and you can think about doing another inequality assessment, say in 5 to 7 years' time, or what makes sense in your national context. So when you're starting to undertake an inequality assessment, some questions to consider are how to choose groups to include in the assessment. So what is your national context? What makes sense in terms of who you think might be some of the marginalized populations in your country? Are there any glaring data gaps that you know of? Are there any populations that you know there's no data collected for, or maybe a certain type of data that's not being collected, or in a certain province or region it's not being collected, or it's not being, maybe it's all paper-based, nothing's digitized, et cetera. And then you can think about if your databases or if your sources can be integrated. So maybe one database has some information and another has a different set of information. Can you link them together to get a more full and in-depth data set? And we'll talk about this a little bit in the lectures going forward. Are your existing data sources being sufficiently exploited? So maybe there's a line ministry collecting some data. Maybe they even collect disaggregated data, but no one is using the data. It's just kind of sitting in a database. So perhaps there's a way to get some better use out of it. But if no one is collecting the data, or if no one is using the data, what would you need to do to make that happen? And then finally, a very important critical thing, you don't want to go through all this effort and work and just have that final summary sitting there and not actually inform action or change any kind of policies to improve registration. So one of the questions is, how do you go from the evidence to action and policy change so that you can ensure that everyone's vital events are being included in registration? So we already know some of the challenges to this, and this is obviously not an exhaustive list, but when you're doing an inequality assessment, there isn't a lot of disaggregated data. So sometimes there's data by sex, maybe you have it by age, but when you start looking at things like ethnicity or wealth quintile or education status, et cetera, data becomes more scarce. So it's challenging to find the data that you might want to use. And then another really big problem is your definitions don't often align across ministries. So your numerator and your denominator are measuring two different things. And so one good example of this is often your civil registry or your National Statistical Office, they both use administrative boundaries. There's kind of like a standard defined set of boundaries. But then if you were using, say, your Ministry of Health data and your denominator, their boundaries don't align. Their boundaries align with their health centers. So maybe it's within a 10-kilometer distance or whatever of their health center, which is not the same as, say, your provincial boundaries or your district boundaries. It makes it very challenging. And then we know that sometimes data might be collected, but it's often not disseminated in a timely fashion. It might take years to put it together, to clean it. Maybe paper-based copies sit in a storage box for months and months, so that then your analysis isn't quite as timely as you would like it to be. And if you don't have existing relationships with some of these line ministries collecting the data, it's often not clear on how to share the data, especially if there's any sensitive information such as age or if there's any ID numbers involved or addresses, et cetera. Sometimes data sharing processes are a bit opaque and it's not clear who to talk to or what's needed in order to get the data. And even when you get the data, sometimes there's some issues in data quality. Maybe it's not complete. Maybe some of your variables are missing, or maybe it's just known that there's some flaws. And so you have to assess if it's usable or if you're just going to have to go on to a different data source. And then finally, as we talked about, we want to make sure that our findings inform policy to put in place interventions to improve registration. And for policymakers and data users, we want to make sure that we can say, what do our findings mean? And what are our recommendations based on our findings? So remember, you are the expert. They are not experts in civil registration and vital statistics. So they need your help in understanding what maybe could be done to improve registration and what are the next steps in getting there. So I'm just going to stop here for 1 second and pause and see if there are any questions or comments before we keep going on. I'm also noticing the time, so we're a little bit behind schedule, but I think that that's probably okay. We'll figure it out and we can also make it up as we go. Okay. So if there is no, let's see, no questions or comments, we'll just keep going on to lecture 2. Okay, let me try to duplicate this again. Okay. All right.
Ma'am, may I ask a question, please?
Yes, please.
Yeah, when we are measuring the registration completeness, so the actual figures by the Registrar General, which is on the numerator, will be able to get the correct data. But the data from the other data sources, what are the examples of such kind of data, and what is the sanctity of that data, which we are putting in the denominator? Because I think that is what is giving us the inequality assessment. So what are those examples which can be used as the data source for the birth and deaths which are actually happening in a particular locality?
Good question. So that's what we're going to talk about right now in lecture 2. So we'll go through the different data sources for the births and deaths and some of the things you could think about. So hold that thought. Any other questions before we go? Are you able to see my slides again? Oh, no. Okay, here, let me reshare. Okay. Okay, and now are the slides okay?
Yes.
Okay, great. So we'll talk about who these subpopulations are that might be left out, and then some of the data sources to consider in terms of the denominator for doing the inequality assessment. I've just lost my mouse. Let me see what happens. Sorry, my computer froze. Let me try to re-share again. 1 second. Okay. So some of the factors that might affect whether your vital events are registered or not are your gender, your education level. So this could be both for births, it could be for the parents, and for the decedent, it could be for the family members registering them. The place of birth and also death. So if you were born at home or you're born in the hospital, it could affect whether your event is registered or not. Same with deaths. The income of your parents or your family, your ethnicity, your religion, your geographic location, especially if you live in a remote area. And some hard to reach and marginalized populations might include those living in remote areas, such as isolated, perhaps border areas or mountainous areas or outer islands, etc. Minorities are often some of the marginalized populations, along with the indigenous populations, migrants, non-citizens, asylum seekers, refugees, stateless people, especially people without documentation, people with disabilities. In the case of a birth and even for infant deaths, single mothers are often marginalized. It can be more challenging for them to register events, as well as teenage mothers, as there's a lot of stigma around young mothers. And then people living alone. So especially if you're an older person living alone and you passed away, it could be less likely that you have your death registered if you're not living with family. There's also might be some unknowns. So maybe there's people that we aren't even thinking about that we don't have any data for, and there's no way to know that they're being excluded from the system, but we need to acknowledge that there could be those left out that we just aren't even aware of. We might be interested in a subpopulation, but there's no data at all collected for them in any way. And so those are also unknowns or people who would be left out. But the idea is, as you do an inequality assessment and more time passes, ideally you can improve your data collection because you can capture, at least if you know, if you're interested in certain subpopulations and you know that the data is not being captured, you can document that and try to work with the data collectors and advocate for better data collection. So over time, you would have less of these kind of unknown populations with no data. So some questions to consider. What do you already know about the registration of marginalized populations in your country and who might be left out? So do you already know that some perhaps have no data at all, and that maybe one of the first steps is to collect data? Who do you not have any data for at all? And what information might there be from other surrounding countries with similar context to your own? Are there certain subpopulations that maybe have been analyzed in other countries that are similar to yours and that you could consider experiences from other countries? So here we'll start getting into the different data sources. So this is about registered deaths. And again, your numerator would always be your registered events. So in this case, it's deaths from the Register General. And then you have I put a list of different considerations for the denominator. So the first ones, in some countries, there are very high rates of recording of deaths in health facilities. And so the Ministry of Health actually has pretty good data on the number of deaths in a country. Even if you die at home, sometimes you need to go to the health facility to get a notification in order to perform a burial, et cetera. And so there could be high rates of coverage and good records. And sometimes if you're just looking at, say, a certain region or in the capital city, records from the Ministry of Health might be a good source in that respect. Similarly, you might look at something like burial permits, and this data might come from cemeteries, which could be public or private if they keep a record of deaths. Again, this would be on probably a smaller scale than looking at something at a national level, especially when maybe people aren't buried in formal cemeteries in rural areas. Another source might be police, depending on your national context. So if you have to go to the police or another entity to get a permit for burial, or some kind of, if you have to notify them if there was any kind of death, they might have a record of all the different deaths in a certain region. Or there could be other, similar stakeholders for burial permits. The third source listed here is sometimes a census can ask about deaths in the last 12 months, or maybe certain kinds of deaths, such as child deaths or infant deaths. And so if you feel that that data is pretty robust, it's usually never perfect, but that might be one way to look at the denominator. And the good thing about the census is it often has a wealth of information, so you often get things like ethnicity and age and sex and region, and sometimes they also calculate household wealth quintile. They might calculate, the head of household education level, et cetera. So you can get a lot of detailed information from a census. But unfortunately, a lot of them don't capture information about deaths. You might also be able to look at similarly a household survey. So sometimes there's even from a census, if the census indicated there was a death in the last 12 months, sometimes they can go and follow up and do a household survey asking more information from the household about the death. There's also something called capture-recapture methods. We won't go into the details of those, but it's similar to just going out and trying to estimate the number of deaths, but you can get some detailed information when you go back to the household and interview them. And then another method is indirect estimation. So you can estimate deaths if you have two different censuses and you're basically estimating the number of deaths in the intercensal period, which is the midpoint between the census. The problem with this is you are assuming zero migration. So if zero international migration. So if your country has high in or out migration, this might not really work for you. And the other issue is if you start disaggregating, say, down to the province, again, there's this assumption of migration, and we know that people often move, especially to urban areas in between censuses and between provinces. So it starts to get a little bit tricky. But perhaps this is one way to look at things just so simple like sex. If you have no data at all, perhaps just doing indirect estimation on your censuses, you can do it by sex and get a little bit more detail to understand death registration. And finally, if there's no data at all, you can use some estimates from the UN World Population Prospects data. They provide things like crude death rate, or, there's other estimates from the Lancet in terms of estimate the number of deaths in a country over a year. So a lot of these perhaps are at the national level, but some of them also disaggregate by sex. And Thomas Moultrie, if you attended his lectures, I think we'll put a link. I know some of my slides have a link to his lectures, but also I think ESCAP will have it up there with the notes for this series. He did a very good lecture series on using beer split to use this UNWPP data to look at birth and death registration completeness, and I think you could do it by sex and age, assuming some of the caveats are allowable in your country. So I would encourage you to maybe go have a look at those too if you have no other data sources to look at. And so now in terms of births, again, our registered births are going to come from the Registrar General, and some options for our denominator. Again, if your Ministry of Health has really good records for births, even if they were born at home, sometimes parents need to come in for whatever reason, especially for vaccinations. Or maybe if there's a midwife that travels around and collects records and they end up at the Ministry of Health, if they're pretty complete, that's one option to use for your denominator. Another good source is school enrollment records from Ministry of Education. And these are nice because a lot of times that they have a lot of detailed information such as ethnicity and province, and maybe you could calculate other things such as wealth quintile, etc., which we'll talk about a little bit later. But these get a little bit complicated because you're basically, thinking about grade 1, maybe they're age 6 or 7, so you're looking at 6 years back, the births that occurred, and you have to kind of reverse survive any children that died in that interim period. And again, you're also assuming zero migration, which might not apply to some countries in the region. But if you reverse survive them, you could get an estimate for the number of births 6 years ago. So your completeness might be a little bit dated, but it's one way to think about it if you don't have other data or if you want to triangulate different data sources. A vaccination database data from Ministry of Health likely is also very good, especially for those early neonatal vaccines that happen very close to birth. They often have pretty good coverage. So you might not be able to disaggregate as well as you would like, but likely you would have sex of the child and maybe different regions of the country. Another option would be if you look at the number of children age 0 in your census. So the census, unfortunately, is only every 10 years. But again, the census has very good disaggregated data, so you would probably be able to look at things, ethnicity and perhaps wealth quintile, etc. But assuming also that your data from the Registrar General has these kind of information as well. And finally, then we have household surveys capturing births. So we know that the DHS and the mix often estimates birth registration completeness for children under age 5. Oftentimes they will publish results by province or, sometimes by ethnicity or wealth quintile, etc. So it's another source. Maybe even if it's not published in the survey, they might have a database, and if the sample is drawn in such a way that you can use the information, then that can be used as your denominator. And again, if all else fails, there's still the UNWPP data, perhaps using the crude birth rate or other estimates. These are often available by sex of the child. And so at the very least, you could look at birth registration completeness by sex. So we already kind of talked about some of these as we went through, but if you were looking at recorded births, your provider would be your Ministry of Health. Recorded estimated deaths, sorry. We're talking about deaths again. Again, burial permits could be from public or private cemeteries, perhaps the police or another administrative source. National Statistical Office might have census or household survey data. They would also be the ones doing something such as indirect estimation and helping to provide these other data sources that they're probably familiar with from the UN and other sources. And so similarly with births, the vaccination or the recorded births come from Ministry of Health. Ministry of Education often has school enrollment data. The census and household surveys are the National Statistical Office, and they would also be able to provide some of these other data sources. And just a note that it might be important to also forget or to remember your national IT agency, because they are very helpful extracting data. And if you are linking different data sources, they would be critical in such an activity. And we'll talk about that a little bit more in lecture 4. So just thinking about the subpopulations in your country again, and it's helpful to think about who is collecting the information. And then once you have an idea about who the entity is, do you already have an existing relationship with them? And if not, how would you approach them? Does a director need to go to a director? Could it be kind of a colleague to colleague? You know, what is the situation and what is kind of your first steps, and how would you develop that relationship? And then determine what information they have, and if that can help you with your assessment. But sometimes there are subpopulations that are very critical and you're very interested in, but there's no information whatsoever about them. So one consideration is perhaps an entity is already collecting information, say, such as the vaccine registry or the school enrollment is collecting information, but they aren't disaggregating by, say, ethnicity, or they're not disaggregating. They only have maybe one ethnicity category, but really they should have 3. And so having a discussion with them if they can improve their data collection procedures to be a little bit more inclusive of some of these subpopulations of interest is very critical going forward. And if no one is collecting the information, so say that no one is collecting information on school enrollment for whatever reason, maybe there's just, you know, not the capacity. Consider what might need to be collected going forward and how you would do so. So what are some of the steps and some of the needs in terms of the data, so that next time that you have an inequality assessment, that you have some data available that you would be able to analyze these subpopulations. So revisiting, we kind of had that high level roadmap before. This is just a little bit more detail. So consider your national context. Again, who are your subpopulations of interest? Doing a desk review of available data. And then also think about who is collecting data that you might be interested in. And so once you consider all the relevant stakeholders who might be collecting data, even if it's not publicly available on your subpopulations of interest, you can hold the inception workshop with all the different stakeholders and discuss the populations of interest and some different data sources. And that's a good first way of establishing some of these relationships, and then reach out to these data collectors to try to get some more information about their data. So ideally, you would set up some interviews with them to understand what is being collected, how and when, and what would the process be for sharing the data. And once you have the data, you would assess the quality, you know, compare the definitions of the metadata, determine usability, and maybe some of the limitations, perform the analysis, and also interpret what the results mean. And very importantly, write up your findings for policy and to think about what future interventions could be put in place to improve registration completeness. So we will talk about all of these different steps as we go forward throughout the 4 days of lectures. And again, I will pause there. Is there any comments or questions?
Thanks, Renee. There are a couple of questions and comments already in the chat box. I'm just wondering if you would like to address them now, or whether you would want to go through the first 4 lectures first and come back to these later.
Let's see. So can you use different data sources for different? Okay, so that's a good question. So can you use different data sources in your denominator for different geographical regions, or there has to be a standard data source for the whole country? So I mean, if you're looking at, say, one province, as long as your numerator and your denominator align, it's fine to use, say, you know, Ministry of Education in your denominator for province A. But then let's say you go over to province B, and for whatever reason, Ministry of Education doesn't have province B, but say Ministry of Health has vaccine data for province B. So as long as you have province B from civil registry and province B from vaccine, it's fine. Because you're looking, you know, like, again, this is an exact science. You're not going to have anything perfect. So, and also what you're trying to do is triangulate different sources. So to see, you know, are they all kind of pointing at the same thing? So ideally, you would be able to look at different sources and do some estimates, but oftentimes we only have maybe 1, at most 2 sources, so it's hard to triangulate. But it's okay. You know, the main thing is you want to make sure your numerator and your denominator align for whatever specific variables you're looking at. Dominant can ensure completeness and completeness. Okay, so yeah, so you're, again, this is never going to be perfect. So your denominator is an estimate. You're probably never going to get a complete denominator. So Ministry of Health might not always record all deaths. Education, obviously, school enrollment isn't going to be 100%. There's going to be some children not in school for whatever reason. Vaccines, you know, might not reach 100% of neonates. So you can compensate by that if you knew the completeness of this denominator, but there's always going to be some people that are left out, and you know, you're doing the best you can with the data that you have. Data sources. Yeah. Okay. So we will we'll talk about duplicates in a little bit. Duplicates are definitely something we need to be aware of, and it can be a problem. So. That's skipping ahead a little bit. Let's see here. Oh, asking about 16.9.1. So the 16.9.1 and the number of children with their births registered under age 5. We can post the metadata for that directly from the SDGs, perhaps at the break or you know, later. I can go find that and just put it in here, because it's a little bit different because they are looking at children under age 5, whereas that's not quite what we're looking at here. Yep, sample data, again, yeah, we'll talk about this also a little bit when we talk about surveys. It depends on how the sample is drawn, who might be excluded or included. This is very true. So let's see. We are a little bit behind schedule. I'm wondering, I think what we'll do is we will quickly, I just want to go through lecture 3. And then I think that we will take a break and also start on our exercise 1. And then come back, if that's okay with everyone. So let me reshare again. Let me see here. Okay, so I just want to go over a little bit the importance of geography and why we care about usual residence. So usual residence is very, very important when we talk about civil registration and vital statistics. And it can be sometimes confused or conflated with other measures of geography. So we care about geography because consider remote populations that may not have access to services. So they might not have access to health services, which means that they might have higher mortality rates. They might not have access to registration offices, which means they would have lower registration of births and deaths. So definitely access is an issue in terms of remote populations living in remote areas. And again, in order to perform geographic analysis, our definitions need to align. So both data sets need to have, I use the example of the decedent's usual address. So with boundaries of the province and the district aligning between sources. So your administrative boundaries from your civil registration need to align with administrative boundaries of whatever source you're using, be it health or the census or whatever. And also often when we talk about geography, I've found that in administrative data, especially if you're talking about someone's address, it just is an open text field and people just type it in and it's just kind of a data dump. And so nothing's ever done with it. So it's very helpful to have drop-down boxes for, say, province or district. It makes it very nice and easy to analyze data. And we don't usually need to know, you know, someone's exact house address or apartment number or anything when we're looking. We're more interested in these kind of admin boundaries, say, of a district, right? So I would encourage you to think about the ways to integrate more usable data for geography, such as drop-down boxes. So we'll talk about in a minute why we want usual residence, but if for some reason usual residence is not being collected, but both data sets have the location of, say, the health facility by province or district, you can use this as a proxy for analysis. Again, you need to make sure that your boundaries align between the two data sets. And so when we look at health as a denominator, often these boundaries don't align with other administrative boundaries, and that's a problem, and we might not be able to use the data. So let's talk about, in a very kind of oversimplified example, I'm going to use this country, this made up country of Poplandia, and we'll talk about why we care about usual residence, why we want to use usual residence for geography. So let's say in Poplandia, it's a nice big country. They have this capital here, and there's some of these outer islands. But the outer islands don't have clean water or good sanitation, so there aren't good toilet facilities and whatnot. And cholera breaks out in one of these outer islands. And so all these people here, these are people getting sick, unfortunately. But because they are very remote outer islands, it might take them an entire day by boat and minibus to reach the capital, and that's where the health facilities are. So many people don't go because they can't afford to. It's too expensive. They might be too sick to travel, or both. And so those who do go, they wait until they're very, very sick in order to come to the capital here to get treatment. So all of a sudden, the capital health facilities are now filling up with all of these people from the outer islands who are sick with cholera. And all of a sudden, we're seeing all these deaths occurring in the capital here that were not occurring before. So if policymakers base decisions on deaths by place of occurrence, so if, say, they're using data and they're looking at the code of where the health facility is located, what will they decide to do? Well, probably what they would do is they say, okay, we need more health facilities in the capital, but is that going to prevent cholera in the outer islands? Maybe it'll prevent people from dying that come to the health facilities in the city, but it's not going to prevent the problem of cholera occurring in these outer islands. So let's say that policymakers erroneously do think that there's cholera in the capital, and they waste a bunch of time and resources trying to find where the cholera is coming from in the capital. But actually in the capital, the real cause of death is road traffic accidents. So what they should be doing is they should be enforcing seatbelt laws, ending drunk driving, lighting dangerous intersections, or widening unsafe roads, maybe increasing police presence, because that would improve mortality in the capital. But if they wanted to improve mortality overall, they need to understand, you know, the people that are dying in the capital, where they usually live. So it's a very critical and very important thing. So what we want to know is, at what point would we have to put an intervention in place to stop the cholera death? So what would we need to do to make sure these deaths don't happen? And in this case, what we need to do is we need to have clean water and toilets in these outer islands. And then we also need to build some health centers out here as well. And that shifts the burden from the health facilities in the capital and uses the resources more appropriately. So we need deaths by place of usual residence to put in place the interventions that would have prevented the deaths. And in this case, the example, you know, we need this clean water and sanitation. And if we just build more health facilities in the capital, that doesn't prevent the deaths out here in the outer islands. But from a health facility perspective, it is important to know the number of deaths in your hospital, because you do have to plan for hospital beds or nurses and doctors on call. You need supplies such as oxygen, ventilators, medicines, etc. And, you know, when people come in and that are very sick, you need to plan for triaging and make sure that you have end-of-life medicine. So you need your immediate interventions, basically at the end of life, to try to prolong people and keep them from dying. So you want to know how well your clinic is at preventing these deaths. So maybe not from a public health perspective of how do you stop cholera in the outer islands, but the clinic itself does need this information. Is important. Do they have the medicines, the IV lines, etc.? But again, it's just to iterate that this facility level information is very different. That's literally what do you need in the hospital to keep people alive at the end of life, is very different from what you would need in terms of what intervention do you put in place to prevent the death in the first place, which is clean water and sanitation in the outer islands. And when we are thinking about improving the health and well-being of a population, we often, we want to know that intervention. And so the usual residence of the population is very important. It's important that we can look at that and that we collect the information if it's not already being collected. So I think, like I said, what we will do now, let me put this up on the screen real quick again. We will go on to exercise 1, which you to reshare. So I think that in the chat box, we already have the link to the Google Drive, but I guess the slides here, you can't really, if you downloaded them, there's a link, but also the Google Drive, maybe we can put it in the chat box again. And you'll find exercise 1 on the Google Drive. And this is just kind of a reflective exercise for you to think about your country context and what might be needed for an inequality assessment. Okay, yes, I see that Panita has just put the link to exercise 1 in the chat box. So why don't we had planned a 10-minute break and also some time for the exercise. So why don't we do this? Why don't we take 15 minutes? So we'll have a little bit of a break and a little bit of time to work on the exercise, and we can regroup and circle back on the discussion of the exercise and keep going and see where we are with time. So, and if you have any other questions or comments, please feel free to put them in the chat box and I can have a look at them over the break. So with that, we'll have a quick 15-minute break and regroup. Thanks, colleagues. Okay, colleagues, in the interest of time and making sure that we can get through the agenda today, why don't we come back to session? We are going to use the Jamboard again. So let me, just in case some of those, maybe of you who missed it or it's gotten lost in the chat, let's see if I can repaste it. Or I don't know if Pim or Panita, if you have the link to the Jamboard again, we could put in the chat.
I share it. Share
Okay.
it in the chat box.
Perfect. Okay. Okay, so if all of you could click on the link and we'll go to the Jamboard. So the exercise was just kind of a little bit of a reflective exercise on your country and maybe the situation if you wanted to do an inequality assessment. And so I thought it might be interesting just to kind of get an overview of where everyone is at. So the first question was, has any previous work been done around inequality assessments in your country? So if all of you want to go to the Jamboard and just paste a little sticky note with the name of your country and maybe yes or no, we have the, here, let me try to share my screen so we can all look at this together. There we go. If you can, hopefully you can see. And so if yes, maybe there's been some work on inequality assessments before, you can put your country name and if it was births or deaths and what was analyzed, maybe it was by sex or age or ethnicity or other characteristics. In a lot of cases, I think the answer might be no. So maybe if you don't mind just putting your country and know that this is the first time maybe you're thinking about doing an inequality assessment for registration completeness, and just put a sticky note there and just get an idea of kind of where we're all at. Okay, so we have the Philippines that are saying this is the first time. I just put a little sample of sticky note here. We'll be using the made up country of Poplandia throughout our examples here. So, you know, as an example, maybe Poplandia has done a birth registration by sex analysis in the past. Right, we have Thailand. Any other countries maybe want to, and again, this you can click right here. This little thing right here gives you a sticky note, and then you can just type directly there. And maybe we can also start thinking about, so I'm also just kind of curious about the second question. So maybe no one has actually specifically done an inequality assessment in the past, but has there been a survey such as the MIX or the DHS in your country? And if so, you know, could you do some analysis, say by region or maybe by ethnicity or other characteristics? So I will just, you know, hopefully countries can keep pasting the yes or no so we can see. But if we go to this one right here, so if we go to the number 3 slide on the Jamboard, and we start to think about surveys. So has there been a MIX or DHS in your country, and has it been disaggregated by any particular variables? So again, I use this example for our made up country of Poplandia. Let's say they had a 2014 DHS and they did births by province and age of the mother. I should edit that to say birth registration completeness. Just so we're clear. So maybe if you want to put up some notes, okay, we have the Philippines again. They had a DHS by region, age of mother, wealth quintile. Excellent. So that's very useful information. Any other countries have a household survey, DHS or mix? And I know that maybe there's also, I didn't give you a lot of time to, if you don't know offhand and you have to go pull it up, we had a short break and a short amount of time, but the exercise just has some very basic starter questions that maybe you can reflect on and circle back if, as you're just starting to think about an inequality assessment. So, you know, the next question was about a census. You think about your age 0 population and maybe some other disaggregated data you might have, you know, by sex or the mother's age or residence, ethnicity, wealth quintile, maybe even the education of the parents, etc. And then also starting to think about the stakeholders in your country. There's a lot of different options. Maybe just think about your national context and what makes sense. And then I was hoping if we had enough time, it would be a good opportunity for you to just kind of jot down some subpopulations of interest in your country, just so, you know, as a very basic first starting point that you could circle back to in the future, and maybe think about who has data and who doesn't. And then I asked about opportunities for linkage, but we haven't done that lecture yet, so we're getting a little bit ahead of ourselves. So I think we'll just keep moving with the lectures, and you can use exercise 1 as a template to just kind of brainstorm at your leisure in the future as you start to think about inequality assessments. Let's see, was there any more? Okay, oh, okay, interesting. So it looks like if we go back to previous work done, India has yes by birth and deaths, by age, sex, ethnicity. Oh, that was India. So we're not quite clear, but they have something. And then Thailand, yes, death by areas. Oh, very interesting. There's a study in Thailand, death by area. Okay. But then there's probably some others that maybe haven't thought about doing inequality assessment yet. So this is a pretty novel thing, and you know, we're just starting to think about what can be done, and that's why, again, this isn't always an exact science. We're doing the best we can with the data that we have. Okay, so maybe if as we go and as you think, if you don't mind maybe putting a sticky note up with some more, you know, about the DHS or about maybe any work that's been done, that would be helpful, and we can kind of circle back and have a look where we're all at. So we will keep going, and the next lecture is here is about linkages. Let me pull that up. Okay. So when you start to look at the different data collectors and the different variables, some of your variables of interest might not be collected by different entities. So consider the example of a baby being born, and their birth is, if it was born in a facility, it's probably noted in the HMIS system. And so that system often captures, say, the mother's usual residence, perhaps her ethnicity, her age, the sex of the baby. But there might not be information on things such as the mother's income or wealth quintile or her education, her occupation, other things like that. But in some cases, you can develop a proxy. And one way to develop a proxy for something like low income is to think about who is receiving social benefits. So maybe monthly welfare stipends or subsidies for food, electricity, other social services. So if you know that an individual is receiving some of these benefits, you often it's because they are a low income household. You can use that as a flag to develop a new variable, basically as a proxy to put them, marking them as in the lower wealth quintile. And in that way, you compare those in the lower wealth quintile to all the other wealth quintiles in terms of registration completeness and try to understand if there is a differential. So in this example, perhaps if the mother receives free or subsidized health care, this could be used as a proxy. In some national contexts, this doesn't make sense because health care is free for everyone. But perhaps there's some certain services that you pay a little bit for, but low-income people get it for free, or maybe she got a baby box with like formula or diapers or something upon birth, which certain low-income people get, and that might be marked in the health system. And so any information that you might have could be used as a flag to indicate the wealth quintile of mothers and subsequently babies as well. And similarly, if you're looking at school enrollment data, there also might be information for kids who receive, say, free tuition, or maybe they get a stipend for books or uniforms, or they get free lunch or kind of other social services. Again, this all depends on your national context because maybe all these things are free, all children receive them, maybe sometimes there are stipends, there aren't stipends, etc. So just have a think about what makes sense in your situation and see what data is collected and if there might be some way to develop some proxy variables when you're thinking about income for different databases. But there also might be times where you don't have this information, but one database has it and another database doesn't, and you want to link them together. And one way to do this is if, say, you have a national ID or other unique ID, such as a tax ID number, maybe a birth registration number, and these are very commonly used with different ministries and across databases, then you could be able to link various databases and get more disaggregated information. So going back to the case of the mother who gives birth in a health facility, and the HMIS had her age and her ethnicity and her residence, but they didn't have any information on her income or her wealth quintile. Well, perhaps there's a Ministry of Social Development that does have that information. Perhaps they say, okay, we know that she's low income and here's the social benefits she receives. And they both use her national ID number. So being able to link these two via her national ID will give you a more disaggregated and a larger understanding of the different variables that could impact registration completeness. So we talked about linking by ID. Sometimes you can also do probabilistic linkages, such as using a certain set of variables, such as a person's name, address, birthday, or other identifying characteristics to link between databases. But this is a lot more prone to error and complication. It's harder to do. This is especially true in countries in the Pacific, where maybe the spelling of your name is very fluid. So it's very common that maybe in one database you're Anne, and the next database you're Anna, the next one you're Annie, and they're all kind of spelled differently, and it's just kind of acceptable that maybe it's not quite always the same, and so that makes linkages very hard. And so this is, typos or errors, or maybe you changed your address could make some of these things challenging. But regardless of your method, you need very strong cooperation across different ministries in order to do such linkages, and very, very strong IT capacity. So if the capacity isn't there, it isn't likely that you would be able to link different databases. And it's also very important to have strong privacy and security considerations. So you would need a very comprehensive plan and outline of who will have access to the data and what they're going to do with it and how you're going to protect the information. You want to make sure that there isn't personally identifiable information. You know, if you don't really need names or addresses per se if for your analyses. So, you know, at the end of the day, you're just kind of trying to tabulate by these different variables of interest. So, you know, to have a plan in place to think about how to protect people's information if you do this. So it's really great to be able to link databases and have lots of detailed information, but we also need to make sure that we respect privacy and security and we can do it safely. So we already kind of went over exercise 1. So we're going to move on to lecture number 5, mapping of available data. So who do you speak with and what questions do you ask when you start to think about data availability? And this is just kind of a review. We talked about the different data sources, say for deaths and the providers, and same with births. So these are the different ministries that you might consider speaking with. And in our kind of high-level roadmap, we're here. We're thinking about setting up interviews with data collectors to understand what is collected and how it's collected, and when it's collected, and what can possibly be shared. So availability of disaggregated information and understanding what is and isn't collected, this is very important for your inequality assessment. So the information you need might not always be collected in a way that's immediately usable. That doesn't mean that you should just throw it out the window and forget it. So there might be some work that you have to do. So for example, perhaps one of the ministries collects the mother's birth date and the baby's birth date, but you would have to calculate a new variable to understand how old the mother was at the time of birth. So, you know, perhaps if it's school enrollment data, for whatever reason, they might have the mother's birth date, but you would have to go then figure out how old she was at birth. Was she a teenage mother? You know, was she older, et cetera. And then you might also need to understand when the registration occurred, if it was delayed or not. We'll talk about this a little bit more tomorrow, but you'll need some other variables to try to get a feel for the timeline of registration. And so because of these different factors, your data is probably never going to be perfect when you get it. It's important to understand what these different line ministries or data collection entities, what they do and they don't collect, and what the process is if you request to have the data shared with you, especially if you're asking for unit record data so that you can make your own variables and do some more in-depth analysis over time. So when you're meeting with the data collector and you're starting to think about these things, one of the first questions you might ask is the whole country covered in their database or only certain regions? And perhaps they collect data for the whole country, but it's all paper-based except for the capital or a certain province or maybe a certain facility. So it's important to understand where they're at, because even if they collect data for the whole country, but it's all on paper, you're not going to be able to enter 100,000 records of paper, right? So you really need it to be digitized and ready for analysis. And then the next thing you might want to consider are what variables they have in their database. And it's important to understand how these variables were derived, because again, we need to make sure that our numerator and our denominator are talking about the same thing, the metadata line that they match. So we need to understand if they calculated anything or if they define anything, how they did that. And so, for example, is age a direct question? So they say to the mother, how old are you? And she says 30. Or do they calculate it based on her date of birth and perhaps the day the child was born? And so with that, you might also want to know if they collect information on date of birth, because you could do the calculations and also do a check for data quality on your own. Another thing to think about is how many categories there are. For example, for ethnicity, do they just collect 1 or 2? Do they collect 10? You know, do those align? Are they defined the same way as maybe the civil registry would define them? Do they capture the subpopulations you're interested in? Do they have other or unknown categories for, say, sex, or maybe for ethnicity or for other populations? So, is there a catch-all kind of like other or unknown, and what percentage of the data maybe that might take up? You want to also understand what variables they use for geography. So are they capturing the location of the clinic? Are they capturing the location of the civil registry office? Or do they also capture the usual residence of the person whose vital event is being registered? So if you see maybe province, are you looking at the province of where the actual registry was? Or are you looking at the province of where the person died or where the person usually lived, et cetera? And these are all could be slightly different things. And again, we talked about the example of why we want to know usual residence and how it's important to inform policy. Another question is, so for their data, are the variables captured through an open text field or do they use drop-down boxes? Because an open text field might be prone to error. It might just kind of sit there. They're like, oh yeah, we collect usual residents, but they just type in the address and then you have 100,000 records of just open text and it might not be very usable for analysis. So it's important to understand kind of what format that they're in. If perhaps it's open text, do they code anything, to make it usable, and how well does that work, and what percentage of records get coded, et cetera? Do they also code things, if they are coding occupation or maybe education level, are they using predefined international standards? So that, there's a set of kind of international codes for occupation. Are they using those? Are they using something country specific? Are they using their own, et cetera? For the information that's entered, do they just take it straight from the respondent? So maybe the respondent fills out a form and whatever the respondent put, they just directly enter in the computer? Or are they asking for any kind of proof, or maybe they pull it from another source, such as another database? So for example, age, do they need a proof of ID with an age on it, or are they just taking whatever the person wrote and putting it directly into the database? And it's also important to understand which fields are required to be completed by the respondent or maybe the clerk entering the data, and which ones can be left blank. So in a computer system, sometimes there's an error code that comes up if you don't fill it in. It says, oh, you can't go on until you fill this in. And sometimes it's, it can be left blank and there's no problem. And a lot of your records end up with no information, unfortunately. You also want to understand how regularly the data is collected. So is it collected every month, every year, every week, etc.? But then how soon after collection is it digitized, if it's not digitized immediately, and then ready for sharing? So maybe it gets collected every month, but it only gets entered into the computer twice a year. And so how soon after that could maybe it be shared, because perhaps there's a cleaning process or a review process or other things that have to happen. So there could be a significant lag from the time of collection to the time of data sharing. Is there any quality control during or after collection? So if it's entered into the computer, is there any error codes that check like, oh, well, wait a minute, this person's date of birth is after the date of death? That doesn't make sense. Or like this, the mother's age is age 5 or something like that. Is there any kind of quality control? Or, do the clerks who maybe review paper forms ever go back to the person, again, ask for ID or proof of information to check for some of these quality issues? Maybe the data collector is already aware of some quality issues in the data, so it's important to ask them, is there anything to take into consideration? Do they know that there's any problems with the data? Perhaps they know that so occupation, for example, that they're not very accurate, or maybe they know that usual residence isn't very accurate because they, sometimes people in remote areas come to the central health clinic, but they stay with family near to the clinic, so they put the family's address, which isn't actually their address, and so then maybe the data is not very reliable. And the clinic is aware of this, and they could inform you, yes, we collect this data, but it's not usable because of X, Y, Z. So it's important to ask these questions. And do you know how many records are blank for this variable, or maybe how many are of dubious quality, and also for duplicates as well? So perhaps they collect data on ethnicity, but actually 50% of the records are blank because it's not required, or for whatever reason, maybe it gets entered wrong. So they say it's probably not of the best quality, or perhaps not even usable. And then going forward, how often is the data publicly disseminated? So if it's publicly available, how often does it get put out there? Is it maybe every year, every 5 years, etc., on request? And if maybe it's not made public, but it's collected fairly regularly, how often is the database updated? So maybe if data is only entered once a year, or maybe it's only when they have funding to enter it, perhaps there's a 5-year backlog. It's good to understand, the timeliness of the data. And similarly, how many years do they have data for? So is it just the most recent year? Does it go back 5 years, 10 years, etc.? Or maybe the data that's been digitized is 5 years old, and then they just, again, have a backlog or they haven't caught up for whatever reason. And then what is the process for requesting the data or for sharing it? So once you find that there is data you're interested in and they have the variables, how would you get access to the data? Do they require a formal request, say, from the head of the department to their head of the department? Does it need to have a formal MOU? Is it more informal that you can just send an email to your colleague, etc.? And maybe even how would you put something in place that it could be regularly shared, say, every year? And then finally, you might want to know in what format can they share the data? Can they share unit record data? Because you might need to make some of your own variables, such as calculating your own age or delay in registration or recoding some things into your own ethnicity categories. Or can they only share pre-tabulated data with you? And that is important to inform maybe your future analyses, what you can and can't do with the data. So when you go to request the data from an entity, it might be helpful to think about what to put in your request so that you don't have to keep going back and forth many times. So it's helpful to have a short summary of what the data will be used for. And if you know that the data can also benefit the data provider, it's good to put that in there. So perhaps it can help them improve their data collection or quality, or maybe even inform some of their own interventions. So you're using this for an inequality assessment. It's important because you want to make sure everyone's births and deaths are registered. It helps improve public health and policy, and everyone gives everyone a legal identity, etc. So, just a short summary of why you're doing this. And then you want to put what format of data you're requesting and why. So if you are requesting unit record data, which could perhaps be seen as a little bit more sensitive, explaining why you need this format, that you're going to create this new variable X, Y, and Z, and you want to understand delayed registration, or maybe you want to do a wealth quintile calculation, etc., is useful for the data provider. So you're kind of explaining why you need it in this format. And it might also be useful to just mention that you don't actually need sensitive information such as names or national ID numbers or someone's address if it's a text field. Maybe all you need is the province or the district, etc. And then, a list of the variables that you're requesting, but it is helpful to think through with your data provider what variables that they have and then what you're trying to calculate and what you might need from them so that you can have a final list for your analysis. And again, this is often a learning process. Not a lot of countries have done inequality assessments, so it's probably a bit iterative, but you're probably more likely to have success in getting the data if you don't have a lot of back and forth. So trying to think about all of these things holistically when you approach the data providers and try to put it together in one nice summary will increase your chances of success. And then just the final note here is make sure to include the years you are requesting data for as well. So when we're thinking about the data, some of the variables you might be requesting from the data providers for births are listed here. And those that are bolded are some of the things you might look at in terms of the inequalities and doing analysis. And some of the things that are not bolded, you might need to do some of your calculations. So for example, the date of birth of the child, the date of birth registration, perhaps the date of birth notification, you might need these to calculate some other variables, so they're very important. But then based on if the child was born at home or in a health facility, did that impact their registration of birth? You might also, their age at the time of when they actually got registered or when they were vaccinated or school enrollment. These are all very important things as well. Where they live, hopefully you can get usual residence data, but maybe you only have data from the clinic, for example, or maybe the registry office location. The sex, the ethnicity, the wealth quintile, religion, migration status, all of these things could impact the child's registration of their birth. And similarly for the mother and the father, the date of birth is useful because you can calculate the mother's age, and then you can assess whether, say, very young mothers or maybe even very old mothers are less likely to register the birth of their child. And then these other variables are similar to the child's because these also might all impact the registration of the child's birth. And again, we'll talk about this a little bit more tomorrow, but it's important to think about, do the metadata of these align across agencies? Is your numerator and your denominator, do they match? Do the definitions are the same? And if they aren't, can you use a proxy? And if you use a proxy, do you need some other information that's not listed here in order to calculate a new variable? So these are by no means exhaustive, but this is a very good first start, and maybe the different kinds of data you're hoping to collect from data producers. And then here's a list for deaths. Again, for the decedent, you want to have their date of birth and their date of death, and because maybe that's how you would calculate their age, or just check their age for quality purposes. Similarly with the data registration, data notification. And then you would want a little bit more information, their place of death, if it was at home, maybe it was out in the community, say a road traffic accident, if it was in a health facility, what they died from. And then all these other categories are very similar to the births, except for the living status, because you would want to know if perhaps if they were living alone, they might be less likely to have their death registered if there's no family around to register them. And in terms of child deaths, especially young children, it might also be important to get some information on the parents, because all of these factors might also influence the registration of children's deaths based on these characteristics of the parent. Similar question, do these align? If they don't, do you need a proxy, and what might you need to calculate that proxy? So there might be some other information that you need to add here when you're thinking about the variables that you're going to be investigating. Okay, just take a pause real quick here, and I'll check the chat box and whatnot and see if there's any comments or questions thus far. I see a question about, can we add time of birth? I'm not quite sure I understand the question. Do you mean like, were they born in the morning, day, night, or is that asking something else? Maybe you can clarify a little bit. Okay, well, we're going to talk about the time gap in terms of delayed registration tomorrow, so I don't want to get into that too much today. Since introduced to ensure. And then, of course, yes, this incentives, disincentives to ensure completeness. This comes in when you think about, policy and interventions to improve registration, which would be something that we can think about on the fourth day, especially when we are trying to summarize our results for policymakers. What do you mean by, please clarify what you mean by living status. So I'm just saying sometimes older adults might be living alone. They don't have any family living with them. So if they were, say, a single person living alone and they died and there's no family around to register their death, they might be less likely to have their death registered. And so if it's possible to look at by living status, if you were living with family or living alone, it would be interesting to compare death registration completeness. And I imagine that you would see lower completeness in those adults who were living alone by themselves. Hopefully that answered the question. Okay. I'm going to keep going with the next lecture, and then if there's other questions, please feel free to put them in the chat box as we go along. Okay. So let's say that we have done our desk review, we found what data we have, we've done all of our interviews, we have collected our data, or at least we kind of know what's out there. But we live in an imperfect world, and we know our data is imperfect. So how do we select which data to analyze for our inequality assessment? You know, you've thought about your national context. There's a lot of different population groups, probably a lot of different marginalized groups. So how do you choose which ones to analyze? Because you can't do it all. And just to reiterate that inequality assessments are not an exact science, but we do want to know with as much rigor as possible who is being left behind. And we'd also like to know the magnitude of you know, the inequality, how much they are being left behind, what is the differential in registration, because that will help prioritize our resources. So there's perhaps quote unquote good news. When you're trying to figure out what subpopulations to analyze, the choice might actually be made for you, especially for your first assessment. Because until you can use your first assessment to inform more disaggregated data collection and get more data in the future, you really can only work with what data you have, and oftentimes it might not be a lot. So just to reiterate here, remember, here's just a reminder of our numerator and our denominator, and we just need to make sure that the two align, and we're going to go through this process and kind of talk about that and make sure that we get there. So we had our subpopulations of interest that we started with in our country, but then we have to think about the subpopulations that the civil registry can disaggregate by. Because remember, our numerator and our denominator have to align. And if they aren't collected by the civil registry, then they can't be in our numerator. And if we can't make a proxy, or if we can't link to other databases, then unfortunately we won't be able to analyze by that particular population. In which case we have to focus on the subpopulations that the civil registry office can provide data for, or where we can make a proxy or link to other databases. So that's kind of our first step right there. And then going down to the next level, so we want to make sure that the subpopulations for both the civil registry and the line ministry, or whatever our denominator source is, that they match. And so if the line ministry does not disaggregate by whatever the civil registry does, and again, the data can't be linked, or you can't make a proxy, then we are not able to use this data. So here's our little equation down here again, just as a reminder. So we need to focus on our populations that both the line ministry and the civil registry office have data for. So that really will probably narrow it down quite a bit, because we need it for both the numerator and the denominator. And then going forward, you have to make sure that the numerator and the denominator align, right? So you can't compare apples to oranges. You need to compare apples to apples. So in this case, again, we talk about the boundaries. So if the Ministry of Health boundaries are specific to health facilities and not the standard administrative boundary perhaps used by the Ministry of Justice or the Civil Registry Office, we're not going to be able to use the data. So then we're going to have to focus on subpopulations where the definitions align between the two sources, between the numerator and the denominator. Or if we can create a proxy or somehow, you know, map the sources in the case of geography, which is often challenging to do. So you might find out that when you talk to everybody, like, okay, great, you collect this data, your definitions align, perfect. But then getting the data might be a whole nother story. So there might be data sharing privacy issues. They might not have it digitized, or there might just be, you know, a general kind of reluctance or slowness. And so you might not actually ever receive the data. So then that's very practical. You would just focus on the data that you actually have in hand. And so now you can see that things are becoming very, very limited and narrowed down at this point, right? And then once you have the data in hand, you would need to do your own quality assessment. And so, for example, you might find that actually 50% of your records are blank for your variable of interest. So say ethnicity. Maybe there's a lot of missing information, or maybe it's of poor quality. So the suggestion is to focus on subpopulations where at least 70% or more the records are complete and hopefully of usable quality. And we'll talk about this a little bit more tomorrow, some of the ways that you can look at data quality and whatnot. But you would need both your, you know, the civil registry and the denominator, whatever line ministry or whatever you're using, to have complete and pretty good quality of whatever subpopulation you're analyzing. And so this is where things start to get really tricky. And again, why we have to just work with the data that we have, it's going to be challenged to be very precise and perfect. So at the end of the day, we went through this whole list. We need our civil registry and our line ministry to both collect the data. They both need to use the same definitions for the data. They both need to actually provide the data to you. And then the quality of the data has to be acceptable. And then from there, you would go on to do your analysis. So I have a question for you. And my question is, okay, let's say, so once I know that my civil registry is not collecting data for certain populations, does that mean I should not waste my time or other people's time asking if they collect data for these populations? So for example, if your civil registry does not collect data for ethnicity, should I not ask about ethnicity in interviews with Ministry of Education or Ministry of Health, etc.? So we'll take a little pause there. We're going to put a little poll up in the chat box. I think Pim maybe already, or Panita made a poll.
Yes, could you wait? Yeah. It's uploading.
Okay, so we have a little poll here. So question, if the civil registry doesn't collect the data, should you still interview the other data collectors about the subpopulations? So let's take a little vote here. You guys can choose your answer here.
If you couldn't see the poll on your screen, you can see in the chat box.
Yeah, in the meeting chat, there's a little poll here, and there's also a pop-up on the screen. We have one vote. Also, I'm pretty sure it's confidential. We're not checking who's saying what, so don't worry. You can vote for whatever you want. Okay, so we have a vote for save everyone's time. We have one vote for I'm not sure. Two votes for I'm not sure. Okay, one for asking. Oh, no one's voting for my trick question. All right, so far the most popular one is that you should still ask about these subpopulations anyway. And yeah, that's right. So the majority, you guys are following right or wrong. So you can still see the slides, right? I'm still sharing, I think, right? I wasn't sure if yeah, okay. If for some reason you can't, let me know. But we still want to know who is being left behind in the data collection. So that's actually a very important component of the inequality assessment. So even if the civil registry does not collect data for certain subpopulations, it's important to investigate if other data providers collect this information and what level they disaggregate it at. Because it's also important to document who is not being collected and by whom. So the civil registry might not be collecting, maybe Ministry of Health isn't collecting, et cetera. And that's an important finding in and of itself, and it has its own policy implications. So when you write up your final report, a summary of who is being left behind of what data collection should definitely be included, along with your recommendations on how to address these gaps. So, for example, perhaps the Ministry of Health collects information on ethnicity, but they only have 1 or 2 categories, and actually you need 3 or 4 to align with the civil registry or vice versa. Or maybe no one's collecting the information at all, and you want to request that this be done, maybe by different entities or in different ways. So it's really important that this information gets included in your report for awareness and also to improve disaggregated data collection in the future. And then once these things become aware, maybe entities can start better disaggregating data or collecting more data. You'll have more data to do an inequality assessment in the future in, say, 5 to 7 years' time, and then you can have an even more in-depth and detailed assessment and start analyzing registration completeness for more groups over time. So it's absolutely critical that, even if the civil registry doesn't collect it, you should still ask other entities about it. And that also gives you some leverage to go back to the civil registry and say, hey, look, Ministry of Health is collecting ethnicity. They have 5 categories. It's actually really important because we think that, this certain population is left out and are not being reached. And is there a way to collect this information? And so we can have, better information and reach those marginalized populations. Okay, so with that, we are ready for exercise 2. So here, let me actually quickly check the chat box. I think there was a couple questions before. I just want to make sure. There was a question about timing of birth. I think in terms of the inequality assessment, you wouldn't analyze inequalities by that, but in terms of data quality, yes, like that can help improve your data quality. I'm not sure if I missed any other questions, please feel free to also put it in the chat box again. But with that, why don't we go on to our exercise 2? And these are some theoretical examples and considerations on how you might move forward based on data quality. So I think maybe the best way, I will give you 10 minutes to get started on it, and then we can kind of check in and see where you are and maybe discuss the first question. And again, this is on the Google Drive. It's exercise number 2 Word document. And if you need any help or get lost or have some questions, I'm still here, or feel free to put something in the chat box, and we'll take about 10 minutes and maybe reconvene then and start to discuss the exercise. Thanks, Panita just put the link to the Google Drive in the chat box, so you can go there and find exercise 2. Okay, colleagues, we'll just kind of check in and maybe do this piece by piece. So the first exercise question was, the country of Poplandia is hoping to undertake an inequality assessment on death registration completeness. And there's a little bit of information and background. And so you'll see part A was, can analysis of death registration of ethnicity be done with this data? If not, what other considerations or proxies could be explored using these two data sources? So you can see that there's a poll here in the chat box again. So what do you think? Can analysis of death registration of ethnicity be done using this data? So yes, no, I don't know. We'll give everyone a minute to go ahead and have a vote and see what people think. Okay, so we have 13 votes for yes, 4 for no, and 2 for I don't know. And if we can also move over maybe to the Jamboard to discuss kind of the second part of that, which is, if not, what other considerations of proxies could be explored using these two data sources? So maybe if we could put there we go, we got the link to the Jamboard again, and then we are on slide number 5, and I can share my screen so we can all kind of look at it together as these start coming in. Okay, so here we are. It's a bit challenging. I don't know about you, but my eyesight isn't so good, so I wonder if I can zoom in a little bit or something. Okay, so the comment by Thailand was suggesting that they merge data using the personal identification number. So thinking about linkages. Death and sleep return. Okay, where are we at in our votes here? So we have 15 yeses, 5 no's, 2 I don't knows. So we're missing some people. We have 45 attendees, but not so many votes. We got 50% of the people have voted so far. So this one, I wouldn't call it a trick question, but maybe it's a little bit tricky. So the yes and no is kind of both, right? So my response was no, because the Ministry of Health does not collect the data on ethnicity. So if they're not collecting it, you don't have any data in your denominator. So even if in your numerator you have it from civil registry, you can't compare. You wouldn't really be able to disaggregate. So in that case, just if you only looked at it that way, you would not be able to do analysis on ethnicity because Ministry of Health does not collect the data. However, you could think outside the box in a few ways, which might be able to get that data there. So I'm wondering, anybody else have any thoughts on maybe how you could think outside the box on getting data for ethnicity? Going to our Jamboard. Okay, so maybe what I will actually do, I'm going to paste in kind of my response of what I was thinking. It's kind of big, but in the interest of time, let's see if I can put this over on our Jamboard here. Oh, that's very small. Oh dear. Can I make it a title? No, it's too big now. All right. All right. Oh dear. Well, maybe it's easier if I just share my Word document. Let me try to do that. Oh, this is the one without the answers. Nope, that's not going to work. Okay, try this again. Okay, so hopefully you can see my Word document here. I'm going to try to zoom in a little bit. Maybe you can read it. So the way I kind of was thinking about this, and there's no right or wrong answers, and it's great if other people have even more ways to think outside the box, but it wouldn't really be possible if Ministry of Health doesn't collect the data. But however, let's say that maybe in Poplandia, certain regions are populated by 99% of the same ethnicity. So say there's province A up here, and 99% of province A is one ethnicity. In that case, maybe you could use the province as a proxy for ethnicity if you knew that certain areas or regions or whatnot are one ethnicity. And also because Ministry of Health and the Civil Registry in this example do not both collect the usual residents, you might need a proxy for residents. So in that case, you might look at the location of the health facility and location of the Civil Registry, and that you would maybe assume that people who lived in that area gave birth in that area and registered in that area. Looking at it at a high level, maybe from a provincial level as a proxy would have less error because maybe you traveled to the health facility to give birth or you traveled to the registry to register, but you probably didn't travel too far or move many provinces to do so. But if you start looking at the district level, then you're probably going to get a little bit more error in terms of people going to certain facilities for birth or people going far away to register if there's no registry in their district, and you probably couldn't do analysis at that level. And then another option is to investigate whether linkages to other databases might be possible using a unique ID, which other colleagues have put in there. And perhaps looking at a tax ID or a national ID or those kind of things could be used that maybe other databases have information on ethnicity. So let's see, going back to our, so our poll is good, like yes and no are both actually correct. It just kind of depends on how you look at it and how you define it. And if we go to our Jamboard, we have some more. Yep, we have location of the clinic can be used as a proxy, exactly. Let's see. So why don't we take, we only have about 10 minutes left in our session, so let's take 5 minutes to have a think about question 2, and then we can circle back and kind of go over question 2 together and end the day there. So I'll give you 5 more minutes to have a look at question 2, and then we'll reconvene. And again, if you have any questions or comments, feel free to put them in the chat box.
And another.
Okay, colleagues, so maybe in the interest of time, we have about 5 minutes left. I'm going to share my screen for the second question and some of the answers I typed up in red. So this is, again, our fictional country of Poplandia, and they're hoping to look at births, and they're looking at the Ministry of Education data. So what variables might they be able to analyze? The sex of the child and the age of the mother is pretty clear, but then some of the variables that might have some problems are ethnicity, for example. So you might be able to explore what percentage of Indigenous children are labeled as such in the Civil Registry Office, because the Civil Registry is requiring documentation from both parents, basically to prove that they're Indigenous in order for the child to have the status of Indigenous. Whereas the Ministry of Education, it's a self-reported field. So Ministry of Education, let's say your mother's Indigenous and your father isn't, you may still identify as Indigenous and put that in the Ministry of Education, but the Civil Registry does not recognize you as such. So in that case, it's unlikely you would underrepresent registered births for Indigenous persons, since the Civil Registry might not flag all children who are Indigenous if both their parents didn't have documentation or weren't identified as such. So if there's a way to maybe explore the percent of Indigenous children that aren't labeled in the Civil Registry that maybe identify as Indigenous in Ministry of Health, that's one option. Another thing you could do is looking at the Ministry of Education data. Perhaps you could filter by looking if there was information on parents, to try to look at parents that are both identified as Indigenous and compare that to the Civil Registry, because hopefully in theory those would have a little bit better match or alignment. And further analysis by residence and location might be problematic. So remember, we're looking at school data. This is a 6-year kind of post-birth period, maybe more, depending on what age group you're looking at. So if you use the location of the school and the location of the registry as a proxy, it's quite possible that maybe children have moved since they were born. So some of them, again, we don't really want international migration because that will affect our analyses, but even within the country, maybe they move provinces or move cities. And so we're making some assumptions there. And children might have been born in major hospitals and then returned back to their families. So this is especially true if a woman had a complicated pregnancy and she had to go to a major hospital, or maybe she lived really far from a health facility. So using the health facility or the school location as proxies might have some complications. We're making some assumptions there. Again, if you analyze at a higher level, say the provincial level, you're less likely to have error as if you looked at the district level, because people are more likely to move around and to travel for access to services such as your health facilities or your registration offices. So in this way, we can proceed with our analysis, but it's very important that we explain our assumptions, our caveats, the way we developed our proxies and our methodology. And when we go to analyze our results, we need to take all of this into consideration and see if maybe our data doesn't make sense because we made too many assumptions, it's not quite accurate, or maybe it does, maybe it's okay, but we have to keep some of these caveats in mind. So going to the second part, this is a little bit more kind of technical, and we aren't going to really get into these things too much, but just something to be aware of when you start to go over if you're going to use Ministry of Education data to estimate births. So one thing to think about is what percentage of children are in school in your country. So if it's very high, say 95% or more, that's, data is probably usable. But if for some reason it's low, say 65% of children, or perhaps specific ethnic groups of children aren't in school, this data might not necessarily be a very good source for you to estimate births. We also want to consider, does Ministry of Education, is it just covering government schools? Does it cover private schools, or maybe other special education schools, maybe children with developmental delays or disability, because that'll impact your coverage. And think about the migrational context, because if there's a lot of migration in your country and children are migrating and you don't have good data on that, then you can't really reverse survive children, and this methodology doesn't make sense in that context. And then finally, you're also going to need infant and child mortality data for the interim period. And ideally, you have it by your disaggregated variables of interest. So maybe by geography, province, by certain ethnicities, etc. And that might be a little bit tricky, or you might have to make some certain assumptions if you're using that data when you're trying to kind of reverse survive these children to estimate the births in the period prior. So I know that we are right at time right now. So what I am going to do is I can save a copy of the quote unquote answers, or kind of my thoughts or summaries of this exercise, into the Google Drive. And so at the end of each day, as we go through the exercises, I will save the kind of the answer sheet in there as well that you can go reflect upon. And if you have any questions or comments, please feel free to put them in the chat box and reach out, and we can always circle back to them tomorrow morning. So before we sign off for today, just want to check in if there's maybe any dying last questions or comments before we end our session. And I see a little note from Panita asking, mention attention or the attendance certificate. So maybe just check the chat box for her comment as well. Okay, colleagues, well, if there's no comments or questions, I will let you go for your day, and we look forward to reconvening tomorrow, and we'll be discussing data quality and usability in more detail tomorrow. So looking forward to speaking with you then, and I will, as I mentioned, save a copy of this exercise too in the chat box for you. Thank you so much.